My name's Nafiza, I'm a regional dentist for IDH. When I first joined, I was a regional dentist covering lots of different practices in Greater Manchester and Lancashire, and now I've settled in one practice 3 days a week, that's in Keighley, but I still cover loads of different places the other 2 days a week. They've got loads of really good materials and equipment. Everything is available to you that you could possibly want. Loads of different practices, so you're working in all different areas, all different kinds of people, and they employ lots of different kinds of dentists as well. There's newly qualified dentists like you, there's older dentists that have been in general practice for years and sold the practice on to IDH, there's specialists, there's orthodontics, people who do implants, and you'll meet all these dentists as you go through your different practices, and they'll teach you things and talk to you and help you learn how you can develop if you want to be a specialist, if you want to do this, if you want to go on this course or do this exam, and they'll show you how to do everything. It's like being part of a family really, even though it's such a big company. You do feel very appreciated, and you're really looked after. You're not on your own. There's always, if you've got a problem, there's always somebody that you can turn to. There's 10 people you can go to. So you could talk to another dentist in the practice, you can talk to the practice manager, there's area managers, clinical support managers, clinical directors, loads of people that you can talk to. And when you're newly qualified, if you don't know how to do something, there's always somebody that can help you, and they're just like an email away or a phone call away, and they'll kind of go out of the way to help you as well. You feel really looked after and really nurtured. There's loads of different courses at the academy, so I've done the Rotary Endo course, and there's one about NHS claiming and how to work on the NHS and work smarter and things like that. They also have peer review evenings where dentists get together who work in a particular area and they discuss cases and things like that, so I've been to a couple of those. They have things online as well. I've done some of the health and safety things and the radiograph things online, but there's loads of stuff available that you can just browse and look through in your own time. They've got slideshows and things like that. The clinical support manager, Ruth, she comes out to visit you sometimes in practice and just sees how you're getting on and talks to you. And if you've had any problems with any patients or anything, or any cases, she'll discuss it with you and she can help you. And the clinical directors often come out as well and they talk to you about things, and it's nice you can have a little debate with them as well. If you're a regional dentist, within my first 6 months I think I'd worked in more practices than some dentists have worked their entire career. Every practice is different, every dentist is different, every area is different, patients are different, nurses are different, practices run differently. You pick up so many different skills, your communication, working with people, and just different materials. I mean, when you're in dental school, you're only exposed to the materials that your dental school has got, but every practice has got different materials, different birds, different chairs. All the nurses work differently, so you work with different nurses. You pick up so many different skills going to different practices. You also get your GDC and your indemnity paid for, and you get paid a really good car allowance and mileage as well. And they also cover all your lab bills, so you don't have to worry, when you're doing denture work and crown work and things like that, all you think about is doing the best for your patient, and you don't have to worry about that, and that's a really good thing.